It's that time of year and local emergency rooms are overwhelmed with the demands of patients suffering from wheezing conditions associated with respiratory illnesses. A metered-dose inhaler is one of the most effective treatments of respiratory conditions with wheezing. Usually at some point in everyone's life, they will experience a respiratory illness that's associated with wheezing and tightness of the chest. One can provide immediate relief and improve air movement to the lungs by using a metered-dose inhaler. So that you'll be prepared for this type of illness, first we are going to discuss the different illnesses associated with wheezing. Second, we are going to talk about the medications that you can use with an inhaler. And third, we are going to I'm actually going to show you how to use an inhaler. The National Heart and Blood Institute lists the following respiratory illnesses, asthma and bronchitis, as illnesses associated with wheezing. This site states that asthma is an inflammatory disease and that more than 22 million people are known to have asthma. Bronchitis is a condition of the bronchial tubes, the tubes that carry air to the lungs, and they become inflamed. Each of these illnesses affect a person's lungs and their air movement within the lungs. Both of these illnesses can be either acute or chronic illnesses. One of the most common treatments of both of these illnesses is a metered-dose inhaler. Medline Plus Drug Information lists is a website that talks about medications, and this website lists the following medications: albuterol, Xopenex, and Flovent as commonly used medications within an inhaler. Albuterol is a bronchial dilator which works by relaxing and opening the passages of the lungs. Xopenex is a beta antagonist which works just like a bronchial dilator. Flovent is a corticosteroid which decreases the swelling and inflammation of the airways. Any one of these drugs can be used individually or in combination depending on the severity of the illness. The frequency of use also depends on the severity of the illness. One can safely use an inhaler every 2 to 6 hours in the home environment. Any use greater than 2 hours requires medical attention. Inhaled drugs dilate the airways and allow air to pass freely. They also relax the muscles of the lungs and decrease the bronchospasms that are occurring within the lungs. To use an inhaler effectively, one needs an inhaler and a device called a spacer. The inhaler has a mouthpiece and a canister within it that contains the medication. The spacer is also known as a holding chamber that allows the medication more time to move into the lungs. You start by assembling the two pieces together. First, you will take the spacer. You're going to extend it into its full length and lock it into place by twisting it. Then you're going to remove the caps from both the inhaler and the spacer. You then take the inhaler, the mouthpiece part, and insert it into the end of the spacer that's the corresponding elastic end. At this time, you're ready to use the inhaler. You're going to shake the entire unit 3 to 4 times. Then one's going to exhale normally, place their mouth around the mouthpiece of the inhaler, decrease the canister to insert the medication into the chamber, and then you're going to breathe normally, inhale, hold that breath for 5 to 10 seconds, and afterwards you're going to exhale. This breath is called a puff and can be repeated 4 to 6 times depending on the physician's orders. At this time, you've now completed the administration of your inhaled medication and you're ready to put your inhaler away. They need to be stored together so that you'll be able to use them for your next treatment. The spacer actually needs to be cleaned once a day with warm water. In the last few minutes, we have discussed the different illnesses associated with wheezing and the different medications that you can use with an inhaler, and then how to use the inhaler. By using an inhaler correctly, one can improve their lung function, and therefore they should recover faster and prevent future respiratory illnesses. So follow your doctor's instructions regarding inhaled drugs and stay out of the emergency room.